Bladder cancer. Introduction. Please point to the bladder. Choose one of the following options. Correct. All tumors are cancerous. Select true or false. Correct. Only malignant tumors which have the potential to invade other tissues and organs are cancerous. Benign tumors are not cancerous. What is the name of a tumor that invades other organs and body parts? Choose one of the following options. 1. Malignant tumor. 2. Cancer. 3. Metastatic cancer. 4. All of the above. Correct. It is always possible to determine the cause of cancer in a patient. Select true or false. Correct. It is not possible to specify the cause of cancer in an individual patient. Having a risk factor for bladder cancer means you will get bladder cancer. Select true or false. Correct. Having a risk factor for a cancer increases the chances of developing the cancer. It does not mean the person will develop the cancer. Most people who have known risk factors do not develop bladder cancer. All of the following are risk factors for bladder cancer. Which of the following risk factors places a person at the greatest risk for developing bladder cancer? Choose one of the following options. 1. Smoking. 2. Working in the rubber or leather industries. 3. Drinking water with high levels of arsenic. Correct. Smoking carries the greatest risk for developing bladder cancer. The longer a person smokes, the higher their risk is for developing bladder cancer. In most cases, the only sure way to diagnose bladder cancer is through a biopsy. Select true or false. Correct. In most cases, the only sure way to diagnose bladder cancer is through a biopsy. A biopsy shows whether a tumor is benign or malignant. Stage 1 cancer is more dangerous and advanced than Stage 4. Select true or false. Correct. Stage 1 cancer is less advanced than Stage 4. This means it is usually more treatable. Which of the following diagnoses of cancer deals with the shape of the cancer cell? Choose one of the following options. 1. The grade of the cancer. 2. The stage of the cancer. Correct. The grade of the cancer deals with how abnormal the cells look under the microscope. The grade can tell us how likely the cells are to spread. The faster they spread, the more aggressive the cancer is. Surgery, chemotherapy, biological therapy, and radiation therapy may be used in combination to treat bladder cancer. Select true or false. Correct. Surgery, chemotherapy, biological therapy, and radiation therapy may be used in combination to treat bladder cancer. Most people with bladder cancer have some type of surgery to remove the cancerous tumor. Select true or false. Correct. People with bladder cancer found in the earlier stages can have just the cancerous cells removed surgically or part of the bladder removed. Those with later stages may have the whole bladder removed. Thank you for using Explain.